Well, hello and welcome to another episode of Healthy Rebel Speaks Out, and I am your host, Bonnie London. And today I am so exciting because we have, in my opinion, a game-changing guest, and her name is Margaret Floyd Barry, a pioneer in functional nutrition and a real food advocate. She has years of experience really helping the most complex of client cases and has even successfully reversed her own autoimmune condition. She shares this approach through her Restorative Wellness Solution with School, which is a comprehensive 2-year functional nutrition certification program, of which I will tell you that I had the honor to be a part of, and it is amazing. She has over 1,200 alumni, and her team is incredible. And today, what we're going to talk about is why we should not be guessing about what are causing our issues and that we need to be testing. So anyone who is really serious about getting to the root cause of their health or just optimizing their health, then you must listen to Margaret today. All right, well, thank you for being here.
Oh, thank you so much for having me, Bonnie. I'm super excited to chat. This is important stuff.
Oh, yes, been so excited to have you on. But I would like you to begin, if you could, just to explain a little bit, of course, what brought you into this and very passionate about this.
Yeah, like I think a lot of us in the field, I came to it from a very powerful personal experience. There's actually two key moments. I'm going to tell you about the second one. I had my own experience with some horrible, unresolvable eczema that I had for 10 years that I was able to heal through diet and supplementation and a really good protocol. But even more important than that, it was annoying. It was cosmetic. It wasn't fun, but it was the first thing that opened my eyes to the power of diet. At the time I went in there, I was not a practitioner. I was working with somebody, I'd um my diet was basically, I was a carbivore. I was a vegetarian, but all I ate was carbs and, different forms of sugar and a lot of wine and a lot of coffee and dramatic change to my diet. And that eczema that had been plaguing me for 10 years went away completely and has never come back. So that was like eye-opening moment in my 20s. I didn't change careers then. But over this time, my mom had very, very serious autoimmune diseases, 3 of them, in fact. She had lupus, she had rheumatoid arthritis, and pulmonary fibrosis. And it was an incredibly painful process to watch her. Over the course of about 20 years, I basically had a front row seat to both the amazing things about our Western medical system, but also its pretty epic failures. So on the one hand, she was a medical miracle, right? Like, one of those diseases alone, like just the pulmonary fibrosis, that is fatal in many people unless you respond well to a drug. In her case, it was prednisone. But prednisone is not something you should be on in high doses over the long term. And it, plus the combination of all the other drugs for all the other different things, ultimately, side effects from being on these really heavy duty medications over the course of 20 years is how and why she lost her life. So it was always this like 1 step forward, 4 steps back, I remember one time she got a hangnail and that hangnail got infected. She was in the hospital for 3 months with an infection that was completely antibiotic resistant because her immune system was so wildly suppressed by the medications that she was on. So yes, she was alive. Yes, they were keeping the autoimmune under control, but the quality of her life was absolutely miserable. And ultimately, never went into a full remission. She had, it was just this slow, painful process of deterioration. And then, as I said, ultimately lost her life to side effects from the very drugs that were keeping her alive. So that is not something that I ever want anyone to experience again.
Sure. And I
Yeah.
can't help but think, Margaret, that knowing everything you know now,
Oh.
you could have helped her.
Well,
And so obviously, I mean, kind of obviously bittersweet, but what an opportunity you have now to I call it like the ripple effect of all the people that you are helping now not go down that route. But that is a very, powerful, painful story. So thank you for sharing that.
Yeah, you're welcome.
Okay, well, maybe let's just dive into exactly what are functional lab tests and why have you found them to be so valuable to getting our best outcomes?
Right. Well, I think first we just want to understand the key difference when we say functional test. Like, what does that mean, and how does that differ from like a conventional tests that your doctor would run? And I think what's important to know here is just the paradigm difference between conventional medicine, which there's a very, very important role for it to play. So I never want anyone to mistake me for thinking I'm down on Western medicine. I am not. There's in terms particularly of acute care, it is absolutely brilliant. It's the sort of chronic long-term things where I think there's some room for improvement. But when we're looking at labs from that conventional medical perspective, it's about diagnostics, right? They're looking for evidence of pathology for disease state. And then, typically the tools are going to be, either medication and or some kind of procedure, some kind of medical procedure, surgical procedure to sort of correct the situation. It's very symptom based. It's looking at that end result. And yes, the goal is to help the individual feel better. But it's not asking questions that get to the root cause of why those symptoms manifest in the first place. So when we are looking at things from a functional perspective, we're taking a totally different perspective. The diagnosis is kind of secondary. In fact, as non-licensed practitioners, we're not making diagnoses. That's not the most important piece of this puzzle for us. What we're looking at is we have an individual sitting here in front of us who's not feeling well, and we are asking the question, why? Why is this person having such and such a symptom? If we have this sort of fundamental belief that the body is itself a very powerful healing mechanism. My 8-year-old daughter, I've got her indoctrinated. She falls and skins her knee, and I'm like, "You're a healing machine," so she'll now fall and stand up and go, "I'm okay. I'm a healing machine." And we are, right? Like the human body is this most amazing healing mechanism. But it needs the right tools to be able to perform that healing. And we need to make sure nothing is getting in the way of that beautiful state of homeostasis, which is like balance, right? It's where we thrive physiologically. And so functional tests are looking to help us answer the question, what's missing? Like what is getting in the way of the body's innate ability to heal? What building blocks are missing from that process? So we're not looking to diagnose anything. We are looking to find imbalances that we can correct through our tools, which is working with the diet, bringing in key targeted nutrients, making some lifestyle changes, all these pieces that are, firmly under the purview of working as a nutrition professional. We're using those tools in a really informed way to basically give the body what it wants so that it can do what it needs to do to come back in balance and heal. So a functional test is giving us that information. Sometimes it's the same test, like blood work. Sometimes we look at the same test, but from a very different perspective. Often the tests are totally different. So we can talk about some of the nuances of this, but the big picture paradigm difference is the key piece here.
Right, like why, I have a client now, just as an example, who came to me out of desperation, being hospitalized 4 times for diverticulitis. And so when they go in and they give them an antibiotic, I mean, that is what we want to do because we're handling the acute situation and they feel better. But because we're never really getting to that underlying cause, she realized that's why she sought me out, because she realized something is amiss here. And so I think, just to highlight what you were speaking about. Now I understand from having just started in your program that there is you have a certain method you have of which tests go first, and there's an order to it, and maybe you could explain that and what the reasons are.
Yeah, absolutely. So, the body has a priority when sort of an order of priority when it comes to healing. And what we have seen clinically over and over again is that if we don't start with the gut, then we're not going to get very far. There's that saying, all disease begins and ends in the gut. Like this is,
Hippocrates, the
yes, well,
godfather,
Hippocrates, like
grandfather
the
of
OG, right?
of medicine.
Exactly. And so we really need to be looking at digestive health as a fundamental starting point. And there's a number of reasons for this. So, number one, if you go back to what I talked about in terms of just the basics of the functional approach, does the body have the proper building blocks to do what it needs to do to heal? Well, where does it get those building blocks? It gets them from the diet. But it's not just the diet. It's your body's ability to actually, I describe it as harvesting those nutrients and absorbing them into the bloodstream. So you actually need to be able to break down the food that you eat and absorb them into the bloodstream and shuttle them around the body appropriately in order to get the full benefit of, your lunch. It could be the most perfectly sourced, properly prepared, farm to table, organic, blah, 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 blah. And if your digestion is compromised, you're not going to get the full benefit of that. So that's just digestive function that we're talking about there, but that's a really important piece. The
Yeah,
second,
I just have to mention,
yeah.
if you bring up a really good point that's going on right now, and that a lot of people will look at the labels of foods and see, oh, this has, all these different vitamins and nutrients in there. But what they're not taking into account is that does not tell you what you are actually absorbing and processing. And that's all that actually really matters. And we don't care
Sure.
what's on the label, because there are all of these superfoods out there now, unfortunately, that actually have properties in there that can inhibit the body's ability to actually get the nutrients that are on the label into your bloodstream.
100%. 100%. So it's about what you're eating, but it's about your body's ability to break it down and absorb it into the bloodstream. And then, just as a secondary piece to that, if you think about the fact that the vast majority, approximately 80%, give or take, of your immune system lives in and around the digestive tract. What that means is that, remember, your immune system's job is basically internal housekeeping and to protect you from foreign pathogens and invaders. Really, really important jobs. This is like the ultimate healing machine part of you.
Yeah, and when you think about your digestive system, it's basically a tunnel, right? So it's kind of on the outside of your body in a way, right?
Oh, 100%.
I mean, that's the way I like to describe it.
Yeah,
So.
I say we're a really complicated donut. And the donut hole is is that digestive tube, right? And so that's still the outside of the body, as you say. The vast majority of the immune system lives in and around the digestive tract. Anything going awry in there is going to be adding a stressor to the immune system. And this is, if you think about, you think about the nature of the chronic issues that are, the allergies, the incidence of autoimmune is just out of control right now.
It has exploded.
It has totally exploded. There's so many pieces that come back to a dysfunctional and dysregulated immune system. So if we're not addressing the digestive aspect of that, then we're missing a huge piece. Then let's not forget the relationship between your gut and your brain, right? Absolutely intimate relationship. Karan Krishnan from Microbiome Labs, he came and did a training with us, and he's describing that basically these are two parts of the same thing. Like it's the same system. We think of them as two different systems that are related. His argument is no, this is the same system, just two parts of it. So anything that's going awry in the digestion is going to have major impacts on what is happening in your head. So this is everything from mood. This is cognitive issues. This is, think about somebody who has a concussion. Well, very shortly after a concussion, I can't remember if it's hours or minutes, but there's leaky gut minutes
Yeah,
after
and
a
it's the
concussion.
other way also, that if
Exactly.
you have leaky gut, which I don't know what the numbers are, you probably know better than me, the percentage of people who do have leaky gut, which I'd like you to speak to, talking about what that is.
Yeah.
But these people can also have leaky brain, which does not sound very good.
No, not at all. So there's this, most people don't realize that the vast majority of their neurotransmitters, right? Those happy chemicals like serotonin and dopamine, that's made in your gut more than in your brain. So the digestion is just so absolutely critical to so many things. I'm glad that you brought up leaky gut, because that's a really, really important piece, because that's actually part of what takes us into the conversation about inflammation. Because a compromised digestive system can dramatically increase the inflammatory burden in the body. So, as we talked about, that digestive process is really happening still on the outside of the body. It's this complicated donut, the big long tube. Basically, the idea is food goes in, gets processed in different ways. Ideally, there's all these little valves kind of keeping things moving along, hopefully in the right direction. And ultimately, what happens in the small intestine, that is where the vast majority of the nutrients from our diet get absorbed. And getting absorbed, goes straight into the bloodstream. This is this magical moment where the outside world literally becomes you. To me, that feels very profound. We sort of eat and we don't really think about it, but that's like literally becoming you. So to me, that's a very powerful motivator for making better decisions with just the diet piece alone, let alone the digestion, just the diet police alone. Like, that is not, people liken, food to like fueling a car, but the gas that goes into a car is literally just for energy. It's not what is the building blocks of that car. When we consume fuel, that is not just fueling us. When we consume food, that is building us. That is our repair. That is everything. Every little cell in your body was once food. So, it's a profound moment, and that moment happens in the small intestine. The lining of that small intestine is 1 cell thick. That is not very thick, right? And it's like these little, almost like little soldiers, like sitting side by side with these tight junctions, right? These cells, like little bricks, almost in a wall. And what happens is these are supposed to open up very selectively, right? Like, oh, here's a nutrient. We're going to open up, let it through, close it up. Oh, there's another one. Open up, close it. Just very, very selectively letting nutrients pass through directly into the bloodstream to then be shuttled around the body to do their thing. Well, what happens with leaky gut is, for a whole variety of reasons, instead of these tight junctions being lined up nice and neat next to each other, something has caused them to kind of all spread apart. If you think about it, imagine that you had a beautiful home or there's a beautiful building in like downtown Manhattan, right? And they've got the butler at the front door, right? Who like lets people in and out, very selective. Leaky gut is like, all of a sudden, every single door, window, exit way, everything just flies open. Now anything can get in, right? That is leaky gut. It's intestinal permeability. So now what used to be selective is now just letting any manner of things in, which means that not only nutrients are getting in there, now you have some nutrients that aren't ready. They're not fully broken
Digested.
down, right?
Mhm.
So we've got maldigested nutrients of all kinds. We've got toxins. Think about what happens at the end of the line in our gut, right? Some of those things are destined for the toilet bowl and have no business in our blood. Some of that's getting in there. Pathogens. All manner of things that should not be getting in the blood can now get into the blood.
And would
Is
you
that
agree this has increased dramatically over the past decades? Because honestly, so I've been a dietitian for like 25 years. This was something not recognized at all. And still, because I believe a lot of doctors and gastroenterologists were trained prior to kind of all this new information about the microbiome in the past 15 plus years, that it still is not completely recognized. But certainly, maybe if you could just speak to some of the changes that have happened uh, in our environment at large, but of course specifically our food environment that is absolutely contributing to these issues.
Well, first of all of these extremely processed, hyperpalatable foods can be so irritating and inflammatory to that gut lining. They also feed all of the sort of bad guys in our microbiome, which will then exacerbate the situation completely. You think about things like certain drugs that we're consuming, and I'm not just talking about, antibiotics, which tend to be overprescribed. I think we can agree to that. There's a time and a place for them, but they tend
Yeah.
to be overprescribed. That can create a damaged gut environment, but
And we're getting
also
it from
and
our animals at times too.
100%.
So,
Uh,
I mean,
the exposure is, in drinking water, it's kind of crazy. It's almost like we're all on at all times low dose antibiotics, which is a really frightening concept.
yes.
Also, it's like things like NSAIDs, right? Like the over-the-counter painkillers, a lot of those are very, very disruptive to the gut lining and can cause dysbiosis and all sorts of issues. Our overall toxin burden, and the exposure to toxins in the environment, as well as in the foods, of course. I mean, there's just, we
And
are,
certainly, I think one of the biggest things that have happened, and this was not introduced till the mid-90s, is the GMOs. Because
yeah,
they were sold to us saying that they went right through and did not impact the intestinal wall at all. But there's plenty of research to suggest otherwise. And it's beyond just being exposed, it's the products. But I mean, all you have to do is look at the explosion of, yes, autoimmune, but all sorts of neurological issues that have happened since the mid-90s. And it's way more than we are just diagnosing people more,
yeah.
I think. I mean,
Oh, it's way more than that. I heard on not a health podcast, another one, they were talking about the increase in neurodivergence and increase in, people on autism spectrum disorder. And they were arguing, oh, it's just because we have better diagnostics. And I would say, yeah, there's going to be
no,
a degree of that, but that cannot
right.
account for what we are seeing right now. It is, it's unprecedented. I mean, I feel like I say that word a lot, but it really is unprecedented, the stressors that we're experiencing on the body. And I say stressors, even just something like the amazing amounts of emotional stress and mental stress that most people
Yeah.
are under has a very significant impact on our microbiome. Having too little sleep in a night is going to impact your digestive process. So all of these pieces will negatively impact that gut environment and can definitely lead to intestinal permeability. And now I will say the intestinal lining turns over very quickly in a matter of days. So it recovers quickly. But the thing is we are just giving it onslaught after onslaught after onslaught. It's not like once in, maybe once a week it experiences some kind of assault. This is happening multiple times a day, every single day. So the vast majority of people have some kind of compromised digestive function. And that is even in when somebody has no digestive symptoms. I can't tell you how many times, one of my favorite is a case study that I teach quite frequently of a client of mine who came to me with very serious POTS. So that's postural orthostatic tachycardia syndrome. So very, very low blood pressure. She would faint on standing, couldn't tolerate heat, lives in Southern California. So that was quite problematic, couldn't sleep. I mean, all sorts of issues. And she had issues across the board except with her digestion. I remember she explicitly said to me in our initial intake, she's like, Margaret, I could eat pebbles and digest them perfectly. I was like, okay, we'll see.
Okay.
So I said, you know what, this is going to sound crazy, but I still want to start with gut testing. And so we did that, and that and a combination that a stool test and a combination of that and a food sensitivity test. And we can talk about some specific testing combinations that
Yeah,
are very
explain how
powerful.
this actually shows intestinal permeability and actually identifying what is going on there, because
100%.
you speak to something very, very important, because people just assume because they don't have symptoms there that they don't have any issues. But I'm just imagining even yourself with the eczema,
Oh yeah.
this had to do with your gut. And then
Mhm.
I can't help but think about all of the people that come to me with joint pain and arthritis, even hair loss issues, because as you so carefully explained, when these particles that are not supposed to be in the bloodstream get in there, this is systematic. It doesn't stay in your gut, it goes everywhere.
100%. So let me wrap up with this particular client. When we did gut testing, there were so many things going on. And the food sensitivity test showed us that some of the foods that she was actively consuming on a daily basis for their anti-inflammatory qualities, as an example, turmeric. She was eating copious amounts and doing her like daily turmeric latte and all this stuff.
Oh
In
my,
her body, it was actually quite inflammatory. Now that's where testing is really helpful with these things. But to me, we really, the vast majority of our work was on gut healing for this this asymptomatic from a gut perspective client. That's where we did 80 to 90% of our work. And that is what resolved and turned around her POTS completely. to the point that, when she took all of our work to, her different medical practitioners, they were like, they both couldn't believe it. But also were completely delighted to take her off of all of her meds, none of which had been working anyhow. But she had a full recovery, and the vast majority of the work was gut related when she had no gut symptoms. So it is so important. I want to, you mentioned the thing about, the food particles getting into the bloodstream. And I just want to explain the reason why it's so important. And this is the last piece of why the gut is so critical for everybody, is that when you have intestinal permeability, which we can now see that the vast majority of people have to some degree, then that is allowing things that shouldn't be in the bloodstream to get into the bloodstream, which is triggering the inflammatory process. And what disease process does not involve inflammation? Now, inflammation in and of itself, not just a bad thing, but what happens is we get chronic levels of inflammation that never resolve. We don't have that sort of inflammation resolution pathway, and the inflammation pathways can get stuck in these loops. And so the body just gets more and more and more inflamed. And then that's going to show up, as you said, it could be joint pain, it could be headaches, it could be skin issues, it could be gut stuff, it could be, any number of things. But because inflammation is a component of pretty much every single chronic disease process. If you have something that is exacerbating and increasing the body's systemic burden, systemic inflammatory burden, then it is going to be exacerbating all of those things. And similarly, if we can then remove that inflammatory burden and heal the gut, the healing opportunities are profound.
Yes, and as you were speaking, I just can't help but mention, still is considered to be the number one killer, cardiovascular disease, which we do understand the number one cause of cardiovascular disease is inflammation.
Yep.
And so, hitting the nail on the head, but I mean, there has been definitely quite a bit studies talking about even bacteria in the oral cavity. And so this speaks to reason the connection with your gut health and cardiovascular disease, and also connected to that insulin resistance, which is also another root cause, and how these things all are connected.
Totally. Yeah, this is all of these pieces have inflammation as a common thread. And if you can dramatically reduce that inflammatory burden, then I do this at the beginning of class often, where I'll challenge people. Can you tell me something that we can't connect back to digestion in one of these different ways? And pretty much I have been close to stumped, but then when you think about it and kind of process it through, everything can be connected back. Even something that seems as unrelated as like tinnitus, right? What is the itis? It's the inflammation. Like anything that ends in itis is ending in inflammation. So all of these pieces are, I have had clients who look, I've run blood chemistries on them, and I'm looking at their overall sort of risk from a cardiovascular perspective, and numbers can be way out of whack. And what do? We work on the inflammation. We through this digestive process that I'm talking about, we see these numbers resolve. And as part of that process, people might say, oh, well, probably you're getting their metabolic function corrected, which there is an element to that as well, but that's not the only piece. And what I have seen is sometimes numbers are really stubborn. And if we're only working from the metabolic side and we're not bringing in the digestive health, then things just don't move. So to me, it's always, for me, what's the most important is what I'm seeing clinically in my practice, and what I'm seeing in terms of the results with the individuals in front of me. And what I just see over
I
and
love
again is
this.
that.
I mean, the whole idea of, counting calories and not having saturated fat just misses I wish it was that simple, but it's not. I mean, it's
Really not.
crazy. So maybe if you could just go into explain a little more about specifically the gut tests that you do, and what shows up there, and how, exciting it is to actually see because many people come to us, let's face it, where they're still suffering, they don't feel well, and they're led to believe, maybe it's in your head.
Yeah.
But now you can see you have a parasite or a pathogen that can actually cause these symptoms you're having.
And we joke about that maybe it's in your head. I had a client come to me once who was in such major gut pain, but they had done all the conventional medical tests. So this is an example of the difference between conventional and functional. And everything came back up clear, which is like fantastic. There is not a disease process at play here. That doesn't mean that she's well. And what they prescribed her was antidepressants. They did nothing for the gut pain, but they gave her the antidepressants. So yeah, it's quite lacking. So the tests that we like to use when it comes to gut testing, there's two tests that we like to do side by side. The first one is a stool test. The one that we like the best is the GI map. I know everyone has their favorite test. We like the GI map because it is so sensitive. It gets criticized. People will say it's too sensitive. It's picking up things that aren't, diagnostic, which is like, great. I'm not looking for diagnosis. I'm looking for imbalances. One of the things that it picks up a lot that other tests miss consistently is H. pylori. And that has been a clinical deal breaker for many of my clients where it's like they have suspected H. pylori. They have all the symptoms of H. pylori. Nothing is resolving, but in the breath testing that's done or some of the serum testing that comes back negative. So they've been, it says that they don't have it. And then we do the GI map stool test and we see that it's
Right,
there.
it's
And once
just
we
that
address it, they resolve.
right, so putting it another way, the way I would say it is that the other test, it didn't detect it, but it didn't mean it wasn't there.
Exactly. Exactly. And there
Mhm.
are imbalances that can cause someone to feel absolutely miserable that might not be, as I said, it's not a disease state, which is great, but that doesn't mean they're well. So this test helps us to understand what's going on in the gut so that we can support gut healing in a very targeted way. Right. I mean, we're wanting to think about, the digestive function, which we talked about. We want to look at their microbiome and see if it's imbalanced. We think of it kind of like a garden. There's flowers, there's weeds, and sometimes there's pests. And we want to make sure it's all in harmony. We want to make sure that there, isn't excessive amounts of inflammation in the gut specifically, as well as, making sure that there are some signs on a gut test of leaky gut. I will say that's one of the sets of markers that we don't pay as much attention to because there's so many different ways of assessing intestinal permeability. And if it comes back negative, it doesn't mean that the client does not have leaky gut. It just means that that particular mechanism isn't what's activated. So, but we like to use the gut test to tell us how and to inform how we are going to support the gut healing. And then alongside that, we always do the second test, which is a very specific food sensitivity test that is going to tell us which foods right now are triggering the inflammatory process. So we already talked about how inflammation is such a key piece of all different disease states. Um, Food sensitivities are constantly moving. We all have them to a certain degree, but certain foods can trigger the inflammatory process. So they could be a completely innocuous food. Like, yes, most of our clients are going to be having them come off the highly processed foods, the gluten, probably the dairy, these kinds of things, the usual suspects. But what if lettuce is triggering inflammation? What if turmeric, like I mentioned with my client? What if chicken? One of these things that seems so innocent could be
Lemon,
triggering
we
that
had that
inflammatory
one on
process.
someone, lemon.
Lemon, yeah, lemon happens all the time. Garlic, olive. There's different. Can be really any food. So what we do is use the food sensitivity test to identify and then temporarily remove those foods that are triggering the inflammatory process while we work on the gut healing. So it's kind of this 1-2 punch. We do them together because either on their own is not going to get you across the finish line. If we just did the gut testing and we didn't identify and remove those inflammatory foods, then it's a little bit like the analogy that I like to use is if you had like a big cut, a big open wound on your arm, and you're doing all the things to help it heal, like the healing balms and all the stuff. And then every day, 3 times a day, you're running that open wound along a brick wall. That's going to slow down the healing process in your best case scenario. Worst case scenario is it's going to get way worse. Well, the irritants, that kind of that's what those food sensitivities are like. So that's why we need to identify those inflammatory foods. I think of them as food irritants. Pull them out so that we allow that gut lining to heal. Because my perfectly healthy arm, if I ran it along a brick wall, I don't want to do it all day long, but just like a little run along the brick wall, it's going to be fine. It might get a little scratch, but it's going to fine. It's going to recover. That's the way the intestines are supposed to be. Like they can take a little bit of beating up, but they recover quickly. But if it's damaged in there, then we need to give it space and time to heal properly. So then you might say, well, why don't we just identify and remove those foods? And the thing with that is that then you're not addressing the mechanism by which those food sensitivities have been created to begin with. And one of the primary mechanisms for the development of food sensitivities is a compromised gut barrier. Because remember, we talked about maldigested pieces of food getting into the bloodstream. The immune system doesn't recognize what that is. It mounts a response. And if it does this over and over again, that is one of the key mechanisms for developing a food sensitivity. I really need to emphasize that when we identify and remove those foods, that is not for the long term. That is
Yes, thank you. And
yeah,
and another important point I think to mention is a lot of people, so it's very, very different than having an intolerance or like a flat out allergy.
allergy.
And I feel the part of it that's very big to realize is that your response to the food, it can take over days. You're not going to know you had some turmeric, that you had a problem anytime soon. Like you would
100%.
never know without doing the testing.
Yeah, you can't. So, would you like me to explain those? Because I can explain those three different things because they're very different
Sure,
reactions that people get confused. So, you have a
absolutely.
true food allergy. That is the peanut allergy, right? Like that's the thing that our kids sadly have to go to school with EpiPens with, for right? Like it's a
Mhm.
very specific type of immune response. Now, the thing with IgE food allergies, they tend to happen quickly. So it's not like you eat the peanuts today and 3 days later you might have a response. If you're allergic to peanuts, you eat the peanuts and you're responding within minutes. Also, on each subsequent exposure, typically the response gets louder, right? Like think about the bee sting. First time someone's allergic to a bee sting, the first time it's like a big deal. The second time it could be life threatening. So with every exposure, there's not a lot of guessing here because it's like you eat the food, the bad thing happens. And then you eat the
Right.
food again, the bad things happens and it's worse this time. So that's food allergies. A food intolerance is basically that's a lack of digestive capacity to digest a given food. So think of the lactose intolerance. That's the most common example. It's not that there's an allergy to the lactose, and it's not that there is a food sensitivity. What's happening is the body doesn't make the enzyme lactase that breaks down the milk sugar lactose, and you get digestive symptoms as a result. Again, this happens quickly. It's not like you eat the ice cream and 3 days later have a little gas. It's like you eat the ice cream and then like, again, maybe it's 20 minutes, maybe it's an hour later, you're like, oh, bathroom now, right? So it's not something that's mystifying and hard to figure out. Thus, testing sometimes can be helpful, but isn't really required. Food sensitivities, exactly as you said, Bonnie. I could eat something today. Here we're talking, what day is it? It's Thursday. I could eat this food today on a Thursday and then not have a reaction till Saturday or even Sunday. How on earth am I going to figure out that what I had for lunch today is triggering a symptom that happens to me 2 to 3 days later? Also, there's different degrees of response. I can have a moderate sensitivity or I can have a very extreme sensitivity. And I might eat unintentionally 3 or 4 foods that I have mild to moderate sensitivities, but because I eat them all together at the same time, it's actually mounting a much bigger response than if I ate them individually. So it's very difficult to identify what foods you're sensitive to without testing in some way, because an elimination diet, unless you go down to nothing and slowly introduce one food at a time every 3 days, think about those logistics for a moment. You will, it's virtually impossible. I'm not going to say it's impossible because someone's going to prove me wrong, but it is very, very, very difficult,
Well, I mean, this
laborious, and
takes
hard.
out the guesswork. And so to me, the way I think about this, it's like the dose that kind of challenges your immune system, or we've heard the expression, the dose makes the poison.
Yep.
So maybe you could tolerate a tiny bit of
Yep.
turmeric, but then you're adding in all these other foods that are also challenging your immune system. The other thing I always like to talk about is like the straw that broke the camel's back.
Totally.
And so so you have no idea. So in order to give your gut a break, the more that we can take off that's attacking the gut, the more chance you're going to have. And like you were alluding to earlier, what's going on right now, that people's guts are just being attacked by everything. And it's not just the food, it's water, it's, you know, the emotional stress we're going through and things like that. So I think the stuff you're doing is even more important. And so now what I would like for you to talk about a little bit, because one of the, I would say the criticisms in a way of this testing is that, okay, well, how do we interpret this? And what is the point? Like that was, you know, from a doctor because they really didn't know. And to me, that is half of it. Great, you got these, you know, these lab tests. Now what?
Well, that is the most important piece of it. The information is great only if you have a now what and you actually know how to apply what you have just learned about what's happening in this person's body. So what we're doing at that point is we're taking what we've learned from the stool test and we're very carefully crafting a very specific gut healing process. And I say specific and carefully and all these things because it's highly customized. You know, there's a lot of generic product protocols out there. Oh, throw in some probiotics and some gut healing and take some enzymes and you should be fine. I mean, nothing's wrong with any of those three things, but it's not specific to the person sitting in front of you or to you yourself, right? Like it's not, we need to know very specifically. Like I'll use the example of something as simple as constipation. You're constipated. Well, it could be that you don't have enough enzymes. It could be that you have poor biliary function. It could be that you have hypochlorhydria, which means low hydrochloric acid output. It could be a food sensitivity. It could be a fungal overgrowth. It could be an H. pylori infection that's leading to hypochlorhydria. It could be, you know, I can go on and on and on and on. And how we address every one of these things is different. So we use that stool testing to inform how we support the body to come back into balance because it's going to look a little bit different for every person. We use the food sensitivity test to really guide the diet. So yes, we're going to be pulling out the usual suspects, but we're also going to be adding in this layer of temporarily, as I said, really important point because when I first did this work with another practitioner back in my 20s, they forgot the temporary part and I went home and cried because I thought I was never going to eat normally again. But you know, for several months, we're going to be removing these extra foods to allow the body, that gut, to the opportunity to heal. And then once we have had that healing, we're going to slowly start reintroducing those, some of those foods and test the body. And the vast majority of the time, we have fantastic diet diversity. You know, we are not in the business of restricting food. This is about being able to open up food freedom, be able to eat a big variety of things. Now, I say that, of course, I want you to be eating whole foods, ideally organic. You know, I'm not a big believer in the processed foods. I don't really consider that food anyhow. But what I mean is we're not going to take out whole categories of food for the rest of your life. You're not going to be eating just like spinach and salmon and that's all you can eat. Like this is not what this is about. It's about being able to eat as much as possible. Sometimes there's like one or two things you got to keep out for the long term. You know, I would put gluten in that camp for most people, but most of the time you're able to eat most anything and maintain your health. That's the goal.
Well, this is fantastic because I have to say, over the years, I have had clients that have come to me that have gotten tested or even from their doctors given like the FODMAP diet, which is really popular for SIBO, which I'd like to mention to talk about for a second. But my point is that there's no practitioner letting them know how to go back to eating, and I really have seen it creating almost a dysfunctional relationship with food where they become afraid of food. So this strategy, I love it. And at the end of the day, to me, still one of the better recommendations just moving forward is, yes, of course, eating whole foods, high quality, but trying to rotate your intake. I mean, that was from the first class I ever took, that maybe not eating the same exact sandwich or whatever, you know, every day for like months on end, it is not a good idea. Yeah, so there's two things I'd love you to talk about.
Yeah.
Low acid, PPIs, and SIBO. They're
Wow.
separate, but can be connected.
Separate. They can totally be connected. Oh my gosh. Two of my favorite topics.
But the acid, because, you know, but if you listen to any of the commercials, everyone has high acid,
You'd think.
apparently. And we all need PPIs, and everyone comes to me, being prescribed them.
You bet.
So,
Yeah, it's devastating, the effect on folks' health. Yeah, gosh. So hydrochloric acid is vitally important for the digestive process. In fact, I have been known to say, if you were to put a gun to my head and say, Margaret, you could work with one supplement for every client for the rest of your life and only one, which one would it be? Now, I just told you how much I hate generic protocols, but if I had to choose in an extreme circumstance like that, I would choose hydrochloric acid because it is so profound, the impact. So just a tiny little bit about the way we digest food. When the mouth and the body senses protein, one of the things that happen is the stomach secretes a whole bunch of hydrochloric acid, and that is really important. The contents need to be at a pH of between 1.5 and 3. That is really acidic. That is like if I stuck my finger in that, I would get a chemical burn, right? Very, very acidic. What happens in the stomach is what we call churn and burn, right? The churning is the muscular contractions of the stomach, but then the burn is the chemical breakdown of the food. It is very acidic. Now, the stomach is fully equipped to deal with that. It has a very, very thick mucosal lining to protect it from basically digesting itself. But we need that. With insufficient hydrochloric acid secretion, what happens is the enzymes that break down protein aren't secreted properly, which means we're not able to digest our protein fully. It means that B vitamins aren't absorbed. Our minerals aren't absorbed. That acidity is part of what protects us from any kind of orally ingested pathogens along with our food. So you think about like food poisoning, things like that. You are at much, much greater risk if you have low stomach acid.
and B12, don't forget that.
Yeah, the B vitamins, B12 in particular.
Mhm.
The contents of the stomach don't get released into the next stage of digestion until a certain pH is released. So one of the reasons why, and it's the acidity of, it's called the chyme, is what the contents of the stomach. The acidity of the chyme is what actually triggers the opening of that little pyloric valve. That's the valve between the stomach and the top of the small intestines, which is called the duodenum. What happens is if the chyme is not acidic enough to trigger that little valve to open, the contents of their stomach hang out for way longer. What happens in that kind of environment? Well, carbohydrates ferment, fats will go rancid, proteins will putrefy. What happens in those processes? Well, all of those create off-gassing. Now you got pressure, right? So what's going to happen? Well, think about you eat the meal and then all the belching. Could this be part of what's going on? Now, one way is to basically what's going to happen is there's going to be a little tug of war between the little valve at the top of the stomach. That's the esophageal valve that keeps things going down, and the valve between the stomach and the small intestine, that pyloric valve. Between these two, you get a bit of a tug of war. If the one that wins the battle is the lower one, the pyloric sphincter or pyloric valve, and the esophageal valve kind of gives up, well, here's the deal. Your esophagus is a pH of 7. The contents of your stomach, as I just said, need to be between 1.5 and 3 for really proper digestion. Let's say they're not that. Let's say they're like 4 or 5 or even 6. Every number on the pH scale is by a factor of 10. So 6 is 10 times more acidic than 7, not 1 time, 10 times more acidic. 5 is 100 times more acidic than 7. So let's think about that. If the contents of the stomach are not acidic enough for proper digestion, but a little bit of the contents splurge up into that esophagus, which is designed for a pH of 7, very, very neutral. Ow, that hurts, right? Like that's exactly what that pain is.
And of course, the esophagus does not have the protective lining that all of the cells have in your stomach.
Nope.
And as demonstrated when you do the test, we can actually see the downward consequences of not having enough acid as those pathogens are allowed to proliferate, and hence this explosion of SIBO diagnosis, which for those of you who don't know what it stands for, small intestinal bacterial overgrowth. And I get someone almost every week with with this diagnosis. And so I guess, yeah, so how do you handle someone who comes to you who's been prescribed a PPI for various reasons? I have someone now with diverticulitis, and the other issue, which you mentioned complicated, is the H. pylori, which we know can lower the acid, but it is the standard protocol to give a PPI with the antibiotic and everything in order to, because it is a little complicated.
It's super complicated. So this is where it's really important to work with a practitioner who knows what they're doing. You don't want to be DIYing this yourself.
Yes.
At all, like really at all. This is very serious. I know some people, even dosing hydrochloric acid, there's such an art to it. It's a simple and straightforward supplement, and it's very nuanced in terms of how we want to work with it. So, you don't want to take this lightly. It actually, there's a piece of me that's like, how do they sell this at like a Whole Foods? Because
Oh my
you
God.
can do this wrong and cause all sorts of damage. So if you are, let's just start with the simple, you're on a PPI. Let's leave the reason for that off the table. So PPI, that's proton pump inhibitor. It's basically blocking the body's ability to produce hydrochloric acid. That's the most simple explanation. Now, the reason for it's being prescribed is if you have that acid in the wrong place, it's very painful. As you just said, there isn't that mucosal protective lining along the esophagus, and it really hurts. And it can cause damage and ulceration. So this isn't something to be taken lightly. So the response is, okay, well, let's suppress the stomach acid. It's not the root cause. Most often it's actually because there's not sufficient stomach acid. So what we want to do is, we really want first and foremost to ease. If there are any ongoing upper GI symptoms, we really want to ease that. We want to calm that down. And, yes, one approach to doing that is to just, turn down the body's production of hydrochloric acid altogether, or you can introduce nutrients that are very soothing, that are mucilaginous, right? They're going to help to protect the tissue. They're going to help to heal and repair that very delicate tissue along the esophagus and the throat, as well as in the stomach. And then working with a prescribing physician, I really need to say this, there's a process we can go through to slowly wean off of the PPI while staying on these upper GI supports. And then when you get to a place where you are completely symptom-free and have been off the PPI for a while, we actually very slowly and very carefully start to introduce hydrochloric acid. Again, don't do this by yourself. Really work with a practitioner who knows exactly how to do this and can be very careful with it. And then very, very slowly start to bring those acidity levels up to sufficiency, and ultimately not only resolve like the heartburn and all the upper GI discomfort, but now actually be digesting properly, and having that proper digestive function, which has all the benefits, that it is such a key piece. Now, you mentioned H. pylori. I'll circle that piece in, and then I'll talk about the SIBO in a second. So H. pylori is a bacteria that lives in the stomach, and it thrives in a more basic environment. So it damages the parietal cells, and the parietal cells are the very cells that secrete hydrochloric acid. So basically what it's doing is it's like creating this nice little cozy environment for itself. So what happens is you have very low stomach acid levels, and the medical approach, exactly as you said, is to bring in PPIs and as well as antibiotics. The antibiotics are to kill this bacteria, the Helicobacter pylori. And the PPIs are there for two reasons. When you're using an antibiotic, you actually want to have low stomach acid levels so that the H. pylori like really is out there and proliferating. Not the same with herbal agents. So part of the reason for for really lowering the HCl all the way down is to increase the efficacy is the word I'm looking for, efficacy of the antibiotics. But also many people with H. pylori are highly symptomatic. So there's kind of a 2-for-1 that's going on there. When we're looking at this from a functional perspective, first of all, we're asking that question, well, like what allowed this H. pylori to proliferate to begin with? That's a very important question. We're not using antibiotics. We are likely using some form of antimicrobial, but they're herbal in nature, and they don't require the suppression of stomach acidity in the same way that antibiotics do. So we don't need to lower stomach acidity in order to achieve the eradication effects through the herbal agents. But for us, at the same time, we're doing a lot of things. Not only are we trying to eradicate the H. pylori, we're now also wanting to bring the levels of stomach acidity back up so that it creates an environment inhospitable for H. pylori, so that you don't have a situation, which so many people do, is the moment they go off the medications, it comes roaring back with a vengeance because they still have low stomach acid, which is the environment in which H. pylori thrives, right? So we're creating an environment that's very inhospitable to the H. pylori. We're also looking at all the downstream effects of what happens when you have low stomach acid, that hypochlorhydria. So we're looking at, oh, well, what about the other digestive functional issues? What about those organisms that feed off of maldigested proteins? What other imbalances do we see as a result? The gut permeability, as I said, microbiome imbalances. Sometimes pathogens will survive the digestive tract. Parasites are a big one for this. So we're looking at all those downstream effects and resolving those at the same time as creating an environment that's inhospitable for the H. pylori to come back, as at the same time as eradicating it.
So you think you can do that in lieu of treating SIBO separately? Or how do you
So
look?
let's talk about SIBO. So SIBO is, again, it's this downstream result of a lot of different things. Almost always hypochlorhydria, that low stomach acid, is a key piece of that clinical puzzle that has to be addressed. One of the things that we have found, it's funny, we used to teach, in fact, we still have it in our materials, and I'm doing a workshop on SIBO in a couple of weeks for this very reason, is that, we actually have a whole SIBO protocol and strategy that we never use, because when we do what I just described to you with those two different tests, what's happening is we're looking at all the different factors that contribute to that SIBO, right? So basically, SIBO, it's, bacteria, either excess amounts growing in the small intestine, or bacteria that shouldn't even be there in the beginning, right? It should be in the large intestine, and it has accidentally made its way up to the small intestine, which is a totally different environment, right?
And I think that's what, why we see, and I have several clients who just, prior to this protocol, uh, so thanks to you, it's not going to happen anymore, but they keep getting it back and again and again.
Over
And
and
if you
over
go
and
anywhere on
over.
the internet, and you can see how difficult it is to get rid of. So again, it's this different approach of getting to the root cause, because yes, people are going to feel better, and you've killed off, I have someone who is on Xifaxan, which is the #1 antibiotic proven to help with SIBO, like 4 times already.
Oh yeah. It's the biggest problem. It's at 45, the average recurrence rate for SIBO is 45%, and it gets much higher as you get older. Now, there's certain things that, if it's a structural thing, in certain cases, as either like a consequence of a surgical procedure, or there's this, they call it blind loop syndrome. Like there's certain things like that will then, this is a different reason for why the SIBO manifests to begin with. You're going to be addressing that differently. But I'm talking about the vast majority of SIBO cases. They get a SIBO diagnosis, and exactly as you said, they put on a diet that is for symptom management, and it's all about antibiotics. And that question of what allowed this to develop in the first place isn't asked nearly enough. And we have found, to the point where we can't come up with a SIBO case study. We see SIBO in our practices all the time, but we resolve it through doing the combination of the GI map and the food sensitivity test that I mentioned, those two together, and doing that process that I just shared. We keep resolving it, and we don't have a need for doing further SIBO work. And in any cases where it is really, really stubborn, in our experience, it has always been a downstream result of mold exposure, which is that's a whole other conversation. Which
Yes,
is,
I did find that with someone who we could not get rid of it, and it turned out when he left his house, he realized how much better he felt, and we discovered that he had mold. Now, of course, I live in Florida, where,
a lot
I
of mold.
mean, we got mold.
You have mold. You definitely have
So,
mold. Yeah.
well, this has been really fantastic. But so I have one final question,
Okay.
which I think I know the answer. So what is the top consideration when finding a functional practitioner to work with? Because they're not all created equal.
They're not all created equal. You want to have one who has really been trained to do the testing very thoughtfully in a very systematic way. The easiest way for me to answer this is to say find a restorative wellness practitioner because I know the quality of their training. Yes, work with Bonnie. That's just the
Yeah,
easiest
yeah,
thing
there
you
you
could
go.
do. But really, it's a bit of the Wild West out there.
Yeah, no,
And
and you're right. I'll just mention only because as I mentioned, I've been doing this for so long. I've taken other courses and all that. And that's why I had you on today, honestly, because it is a very different methodology of really teaching the practitioners of what these abnormal, bacteria actually represent, but then how to actually treat individually all of the patients. So I think, yeah, so it is hard to know just from someone's letters next to their name.
yeah.
I mean, beyond that, like how are we diving in to know who has the appropriate clinical experience?
Yeah. Well, I would say, I mean, ask for testimonials. Like, look at their track record. I think that's one of the most important things. Is see who, if there are people who that they have worked with who are in a similar situation as you, who got fantastic results. That's really the one of the most important pieces. Designations can get you so far. You want to ask lots of questions about their methodology.
Yes.
And I feel like have instincts around people, like there's certain practitioners that it just doesn't line up, and that's one of the pieces of feedback I will say when I do an initial intake with clients. Oftentimes people are like, this makes so much sense, so ask the questions, make sure you understand the rationale for the testing, for the approach, for the methodology, and how it applies to you specifically. If they can't answer those questions, you want to keep moving and find someone who can answer those questions.
I love that, and I would just add on because I do have clients. I'm sure you've had it happen as well. They've gone to other practitioners and they have a pile this big
Oh
of
yeah,
different
all the
tests,
time.
but they've never been evaluated like really what you're supposed to do with it. So I think to me that's almost the most important question because you're going to spend hundreds of dollars for a test. Why? What are you going to do with it? Tell me, what your personalized approach is. I think would, would be
100%.
would be it. Like, what do you do with this information that's going to be so important for my life? Because it's an investment. Forget about the money part of it, but beyond that, the time and commitment. I mean, it's not that easy sometimes making these changes and doing the protocols, but it's definitely worthwhile. And I'm sure you have over the years many, many more testimonials.
Tons of case studies, so many testimonials, so many case studies. I have a lot of people who have come to me with that stack of 30 plus
Good.
previous practitioners, both
Exactly. And
functional
I'm
and
like,
conventional.
what is this?
Well, and
But
sometimes I go through them and I'm like, well, I can see why they did this. I can see why they did that. But this approach is really special. I had somebody, I don't personally take on clients anymore. And I had someone last year who came to me and I had a quick conversation with her so that I could refer her out. And she burst into tears and was like, Margaret, I have spent tens of thousands of dollars. It's been 12 years. I have been through like 32 different practitioners.
oh my
And she'd been
God.
some big name functional docs. I'm not going to drop any names here, but they were ones that
Okay.
you would all know. And I remember thinking like, oh my gosh, what could I do that, they
Yeah.
can't? But I agreed to take her on. And when I looked through her case, actually, this is such an appropriate thing. What it was is exactly what we were just talking about. Nobody had supported her with hydrochloric acid properly. Now, she was very complicated, tons of upper GI symptoms. She did have H. pylori, very,
Wow.
very sensitive, a ton of other things. So everything she was doing made sense. But these key foundational pieces that I honestly, it almost felt like, oh, this is too simple. They were going to the really fancy, complicated pieces when
Yes.
some of the things that was just a much simpler process, it gets amazing results. I've had clients come to me where I've had to look up their diagnoses and thought, "Oh my gosh, this sounds scary. I don't even know what this is." And I have said to them, "Look, here's what I can do. Here's the process we can go through. It's different from what you've done. I am not a doctor. Like I don't know the ins and outs of your specific disease process. But if it's autoimmune in nature, which the vast majority of things are, then here's how we're going to alleviate the burden on the immune system. Here's the steps we're going to take, and let's see how far we can get. And in many of those cases, we have turned it around completely. And it is, I mean, honestly, it still feels a little bit, it's not a miracle, but there's an element of it's like, wow, I can't believe this works so well, but it really does. It's a powerful healing process. So if you are struggling, if you're out there listening to this and you are struggling and you have not been getting the help you need, reach out to, but are you even taking, I shouldn't say this if I don't know if
Yes,
you're
I am
taking
taking patients.
Okay.
And
So reach out to
yes,
Bonnie. But find someone who can really hold your hand through this journey, because there is a result, there is an approach that will get you across that finish line.
well, wonderful. Thank you so much. This has been a wonderful conversation that is really going to help a lot of people, because that really, my mission here and doing these conversations is really empowering individuals to take ownership over their own health, and not just take it that it's in their head or that they have to feel this way, basically, right? I think that's it. So thank you very much.
Thank you so much for having me.